Rashmi, you're here.
Hi, I'm here at last.
How are you?
I'm good. How are you? What a pleasure to see you.
Same here. All right, before we start, let me introduce my dear friend, my dear beautiful friends, Dr.
Oh,
Rashmi Shetty. She is a dermatologist from Bombay, and we has been knowing each other for 10 years, I guess. Is
yes,
that
much more.
long?
Long. That's long. That's how much we've been lecturing. So that means we've been pretty senior for 10 years.
No, no, no. I'm not
No, no, no,
asking
no.
you, and I'm not telling anybody my age here.
No,
Yeah,
no.
and yeah, just so all of you know that it's not only we has been friends like colleagues in conference, but we hanging out. We went out for
Yes,
dance and also drink
yes.
and a lot
And
more.
exotic dinners that we have had, which I can never forget.
Yeah, and
Yeah.
I think when
Just
I
1 second. I'm just putting a light on. I can hear you.
Yeah. All right. Okay. So just to tell all the audience here, when I asked Dr. Rashmi that what she would like me to introduce her, like, what about her credential? So she just want me to introduce her as a celebrity doctor, dermatologist from Bombay. But I just add on my part. I think she is the only one who I will allow her to touch my lips if I want to get it done.
Wow, that's an honor. We know that one colleague to another colleague, that's a huge honor because we really know what the other person does well.
Yeah, I
Yeah.
know. And just so you know, I think lips, if you want to go for lips, I think the best doctor ever in the world will be Indian doctor. Because
Why do you
you
think
get,
so?
yeah, I
Yeah,
think because all the Indians women had very beautiful lips, but of
true.
course they still need fine tuning. And I think
Yeah,
you had at least 10 cases per day.
easy.
So you get a lot more experience than all of us. But of course, as far as we know, when we're talking about lips, it's very difficult and challenging.
Yeah.
Especially for me,
Same
if
here,
you are
each time.
if you are doing too much, it will be so obvious. It can go wrong easily, and you need just about right. There's just only small window of error that you can go. So today we will talking about your technique and, tips and tricks in learning how to make young looking, hot, spicy, and, natural
Yes.
lips. Yeah, but
Yeah,
before we are
yeah.
going to that, I would like to let you introduce yourself and tell me about what is your practice going on and what is the pandemic situation in India a little bit while waiting for a lot of people to come in.
Sure. So, pandemic situation in India, actually, we're very proud the way the government has handled it and we have controlled it. We kind of jumped at it much in advance so that the hospitals are not overcrowded. We have enough beds, we have enough ventilators. So far, all that is taken care of. 50% of India is not even infected. It's just the other 50% of
Wow.
India, especially the metros, which are really, really bad. Having said that, even control in the metros, the way we are taking care of it is all really well sorted. However, Bombay is not looking a little nice because suddenly there's been a rise in numbers. But I must tell you that the very serious cases are not as much as you would see in probably few parts of Europe and US. So there's no very serious death on ventilator cases are a lot lesser. So that's good. And
Yeah.
my practice, we've just started practicing a week ago. Of course, with
Oh,
all the precautions, with all the gears, with everything, we've just started practice. And for those countries who haven't yet started practice, I'm
like
telling
me.
you, don't be, I know you stick to your
Yeah.
government rules and all of that, but don't be too afraid because it's okay. It's like going back to clinic like before. I would still look at the lips and do the same thing. I would still look at a face and do the same thing. My planning, my approach, what I would do still remains the same. Yeah, but only thing is with a lot more safety gears, lot more masks, all those are taken extra care. But otherwise, pretty much you're back into practice and it just feels alive to go back to hold that
I
syringe to
know.
inject,
I
isn't it?
know.
And to chat with
Yeah.
people, it just feels alive.
Yeah, I has been full-time mom for 6 weeks now.
Oh my
Currently,
God.
my girls get so sick of me. My husband gets
I
so
can
sick of
imagine.
me staying at
I can
home.
imagine. I
I
think I
can't
saw
wait
a
to get
video
back.
about you cutting hair. Did I see that?
Yes, that's right. So I become like,
Yeah, yeah, hairdresser. I can
yeah,
see
I
that.
know. And
Oh, I
we
can
we
hear
we,
your
we
kid saying, "I'm not sick of you." How cute is that?
yeah.
Oh,
And
how
so she just like,
cute.
"Oh, mom, I'm not get so sick of you."
Yeah,
Uh,
don't go to work.
yeah, and then like how do you feel, like do you or the patient, like is this, are they slowly coming back, or they just like still like be scared about infection?
They are very scared. They're coming in slowly. Like I've been, like I said, just practicing for over a week. And we've been only opening alternate days because in between we take really a lot of time to clean things up and to still train the staff. Like we as doctors might really get it, but the people
Mm-hmm.
who have assisted me have always been staff in a private clinic. So they don't
Yeah.
suddenly understand, that extra taking care, infection, virus, aerosol. For them to get that is still difficult. There are times they
Yeah, I
forget to do certain things. So you reiterate and you reiterate to tell them this is it, this is it, this is it. So that's taking me a little bit of a time.
yeah,
And patients,
I think like
sorry, go ahead.
you will like slow we will hopefully slowly get back to where we
Yes.
were before.
Yes, yes. So it takes time. And again, with all these social distancing norms, we are not having the clinic packed. So we are only giving appointments to maybe one third the number that we would give earlier. And in that one third, last minute panic will happen. I'm sorry, doc, I can't come. My daughter just told me not to step out of the house. These things happen
Yeah.
and we have had cancellations. But
Yeah, I
net,
know.
happy to go back to work.
Same here. I can't wait. Hopefully, I'll get back by what, the first
Hi,
of June.
everyone. Yes.
Hi, everyone. Yeah.
Yeah, so Gabriel says
Okay.
hi. Hello from Argentina.
Hi. So let's get to our topic of the day, like lips.
Perfect.
As
Perfect.
as I mentioned earlier, that I think like Indian doctor has the most experience and can do the best job of the lips, like comparing
Oh,
to other part of the world. And first question is, when how many patients like come for you just for lips done, like in a day, and what are their demographic data, like how old are they, male, females, or whatever, and what is the most problem on the lips?
so I wouldn't really have a number as to how many people come in a day. Maybe I'd say five, let's say. And for lip, maybe three might come saying, I want lip done. But when we do a whole facial rejuvenation or a whole facial, trying to make it more attractive, for me, I always touch the lip because it's
I
so
see.
important. Yeah, lip is super important. Even if you're trying to enhance and glamorize someone, after ending up with their cheekbone, probably correcting their jawline or their chin, I always put a little bit on the lip to give that little, glossy, glamorous appearance. So, which is extremely important. Yeah, just a little bee-kissed appearance. That's about it. So that
Yeah.
also I've seen in age of 30, 35, the skin around the lip starts getting very dry, and then there are like lines on the lip, and the skin looks very crinkly. So just about putting in a little bit of a filler there makes the lip look very youthful, and that in turn makes the whole face look youthful. So that's
Yeah, I
really
think
nice.
sometimes you just touch up the definition of the lips, that might
Yes,
be enough,
yes,
right? But I think it will be very difficult for the doctors who who are not familiar with like how to do the lips. So they tend
correct.
to overdo it, right?
Yeah, yeah.
So do you have any male patient coming for lips?
Yes, yes. So we
Oh,
do
okay.
have male patients coming for lips. So for the young doctors who are watching this today, what I would probably the tip what I could end up giving is like Rungsima rightly said. So there are a few zones of lip if you can divide it into. So your
Okay.
border becomes like the filtral column, the white line of your lip. From your filtral column to the cupid's bow, to that upper border is the white line of the lip, where you can just do an entire border with the just thinnest needle possible, with the most fluid material possible. All you end up doing is hold it between your fingers, just go along linear threading with the needle. It's easy, just end up doing just the definition. Sometimes that's enough. But a lot
All
of
right.
times when you're trying to make a lip a little youthful, you may want to do the definition and then just do the body of the lip a little as well. And a much
Okay.
aged lip, you would do a definition, a body of the lip, and then I like to work a little towards these because if you see as as they grow older, the lip disappears. That's
Yeah.
what becomes. This goes down. So just lifting that portion up gives you a nice open lip and substance to the lip, as well as end up working on the oral commissures, of course. If you can just do a little bit of a filler there, it gives you some strength. And I like to build it up all the way from the pre-jowl sulcus upwards. So it gives you a nice lift. And then you want to end up working. See, like if I'm here, that's it. Just a little lift. Makes the lip
Yeah,
look
so
very
it's
pretty.
it's make like,
Yeah.
make your patient look
Yeah.
like they smile all the time, like
They're
giving
just
the happy lips.
happy. Exactly.
Yeah.
And then for men, I usually don't do the definition at all. I just like to work on the body of the lip. I try and work more on just their projections or widening the lips volume, but I don't end up obviously giving them more of a pout or an eversion. That I kind of try and avoid.
I see. And do you use different type of fillers when you're working on the
Yeah.
border and the body?
Yeah.
Is how will you choose?
So I like something with definitely a lesser G prime on the lip, but I do like a medium G prime. Like, can I name products?
Yeah, you can just like make an examples of different brand, so it will not
Okay,
be
so
like.
I know. So, like, if you could choose from the Allergan portfolio, I quite like the wall lift. That's not too bad for the lip. I also like the Juvederm Ultra Plus, which I used to quite like for the lip. From the
I
Restylane
see.
range, I love their Kiss. Kiss gives me
Uh-huh.
more volume and inversion when I require. Like,
I
earlier
see.
even I used to be like how you said, not really fond of doing big lips. But now I have seen when some patients push me to do it and I do slightly bigger than my comfort level, it actually looks beautiful for some people. If they have dainty
Yeah.
features, nice pretty face, nice little eyes, a nice pouty lip, a little exaggerated, will actually look very beautiful. Yeah, just a little exaggerated will look really nice. What do
I
you
think
do,
the reason.
Rungsima?
No. I think it's like, for the people who did not want to, who wants to look good without makeup, you enhance lip a little bit, make them look
Exactly.
so good, like, without like
Yeah.
taking too much of the lipstick. And I think
Yeah.
that
Which is
might be
your favorite product?
so I use multiple range. So, Restylane, since I don't have Kiss available in Thailand. So Restylane is also good. And I also use the MERS product though. We have Bellotero Soft,
Yes.
which I really
Yes.
like for the contouring. And I think the good thing about all these low G prime product, very soft one, is it's attract water. So it will like, help with dry lips.
Exactly.
Yeah, we'll get
Yeah.
into that technique afterwards. And when you get a consultation, so do you have any patient that never think about lip before, just come for consultation with something else, and then you said, oh, you should go ahead and touch up with the lips? Is there any type of
Yes.
patients that come?
Yes.
Yeah.
Yes.
And
So
how you convince
usually,
them to do lips?
so for me, I just end up looking at the whole face like we all do, right? So when we're looking at it, and I end up telling them, we'll do this, whatever we are planning. But if I do touch up the lip a very little, you will love it. Firstly, they'll say, oh, no, lips, doc. I've seen
Yeah,
the
it's
lips
just
and
like,
people look bad and we don't want to do that. Then I usually tell them, okay, let's start work on your face. Then I end up doing their cheek, their under eye, all of those delicate areas. And they look at it and they say, wow, I'm just loving it. It looks so natural, but I can see the difference. It's fantastic. Then I tell them, okay, now you trust me and just allow me to do your lips.
Yeah,
I
that
end up
is the
doing a
good
little,
trick.
yeah, because you need to
And
build the trust. You can't simply tell them to trust. You build the
yeah.
trust and then tell them, now you trust my judgment. Allow me, I'll make it really, really less, just a tad bit. And then I tell them, okay, wait, let me finish a little and show you the mirror so you don't freak out when I finish it. So I finish a little bit, show them the mirror, then they'll say, oh, wow, that's nice. And then I finish the whole lip and they just love it.
Yeah, and then okay, so there is some people asking about complication. We will get
Yes.
to it afterwards, like keep it at the end. I don't want to scare anyone
Yes, there
before
is
learning the
arteries
good
on the
technique.
lip, like
Yeah,
arteries anywhere in the face. But like Rungsima
yeah.
said, we'll discuss in the end and then we will tell you how to take care of it while you inject.
All right. So we already discussed the patients. We already
Mhm.
discussed the procedures. I want to ask you how long of the downtime? Is it the same, or like what do you need to be? What is the precaution for a post injection instruction? Do you have any special like do not kiss anyone, or yeah? So what is
I
your
do that.
advice to the patient? Yeah.
So I always tell them no kissing tonight. And I tell
Uh-huh.
them no
One day
drinking
only.
hot, one day only. So no kissing tonight and no hot beverages, not even spicy food for tonight. And then alcohol, I tell them to avoid. That's about it. Usually what happens is because I tend to work very subtly, very undertoned. So they look at it, they love it. Then they usually call me the next day and they say, Doc, I think we should do a little more. Because
Yeah. Good.
yeah, because instantly it feels fuller. In another 2 3 hours, 10 20% becomes lesser. So
I
then,
see.
yeah, but the first time if I do too much, then they're put off and they're scared.
They
So
will
I
never come
do,
back to you.
correct. So you do that exact optimum, and then they go back and they look at it and they say they're comfortable even on your table. They're not panicking. They go back home. I always tell them it'll go down another 10 20%. Then we'll see if we need to touch up. When it goes back, then they end up coming, and then they are okay if I do a little exaggerated. So the first time, I'm very careful as to how and what I do.
Yeah, and I always remind all my patients that like look, not everyone looks good with Angelina Jolie's lips. You need
Yeah,
to look
have the
like
whole face.
everything, like make everything holistic approach. Like you have
Correct.
to evaluate everything and make it match. And
Exactly.
we are coming to the safer technique. So you tell me already like what type of fillers we are doing,
Hmm.
where you will
Yeah.
be injecting. So is there any special technique to avoid complication that might occur?
So honestly, lip, if you stay in the zone, which is the dry zone, you should not get any complication, number one. Number two, stay superficial, don't go intramuscular. Again, you will not get too many complications. If you do choose a needle, use a very thin bore needle so that you're not extruding too much material at once. Keep moving as you keep injecting. So lip again, you're not putting too much material like you do a cheek lift or things like that, right? So it's a little material. So you're going easy, you're going well, you're going smooth. That's always what's required. Avoid the junction of the wet dry border and beyond that. So that's where your vessel lies. So don't go there. And your vessel, the other way you can hit the vessel is if you go too deep from here, you would still go there, right? To the inside.
Yeah.
So you kind of don't go too deep, just stay underneath the skin of your lip, stay in the dry portion of your lip, stay in the border of your lip. You're actually very safe. So you don't have to
Do
get
you,
worried at all.
do you
And
recommend
slow,
using
deliberate injections. Keep looking at the tissue while you're injecting to see if there is any change. You pretty much are safe.
Yeah. Do you recommend only using cannula or needle is fine?
I am an injection needle girl and I love using needle. To me, it's most precise. So I don't like to use a cannula going from here, trying to inject there, and then the cannula itself holds it up. I somehow can't get it. So for me, it's precise and I want to put very little filler anywhere I inject. So for me, then that precision comes with the needle. And even for the lip, I don't see a great advantage in using a 27 gauge cannula as against a 27 gauge needle. So
Yeah, I
I'm
think like
fine with
any cannula that is smaller than 25 is actually as
Yeah,
sharp as needle anyway, right? So
exactly.
no point. And if you are using needles, so since we are working on the vascularized area, so it will be very easy to get bruise
True,
afterwards.
true.
How will you differentiate between like bruise from bruise and purpuric change from necrosis? So there is
Hmm.
a balance and there is a
Exactly,
differentiation. Yeah. So what is,
exactly.
because a lot of time people come in like get the lips done today and come back tomorrow with the bruise, and they get scared like, oh, if this
Yeah,
is the necrosis or is it getting into my vessels? Yeah. How
yeah,
how do
yeah.
you have tips and tricks like to differentiate between both?
True. So maybe what I do is, one, usually we don't ask them to come the next morning. It's my secretary who calls them. How are you? Is everything okay? So I have warned my office to say, if they say there's a bruise, don't dismiss it and say, oh, ma'am, it's a bruise. You don't worry. Then you just put your whatever arnica cream or just use a massager. Don't do that. If they say there's a bruise, tell them they need to send you a picture. Ask a question if it is painful. Ask a question that if it is has having network like reticulation that you end up seeing. So I ask them to ask all of those questions first. Then I ask them to send a picture. I take a look at the picture. I then ask them to follow up again in the evening to say if it is growing, if it is spreading, do you see any changes elsewhere in the face, irrespective of your lip? Is there any blanching? Do you have any acne kind of lesion on your face? Do you have
Uh-huh.
any network kind of happening mesh on your face? So these are the layman questions that I end up asking them. So I try and understand the progress of it. And mostly it's a bruise. We end up seeing if there's a vascular change or anything happening while you're at the injection table. So it's very rare that probably you would see something late. I know Bangkok injects a lot. So how have you come across of a lot of vascular incidences?
Yeah, so we seen some, but for me, my tricks is I'll ask the patient, is the pains getting increasing or start
Correct.
getting like
Yes.
decreasing? Because most of
Yes.
the time, if it's vascular incidents, the pain will be like going up and up.
Increasing.
But if it's bruise, like it pain for a day and then it start going
Yes.
down, like
Yes.
the healing process kicking in and the swelling like goes down, it's
Correct.
tend to like improve in pain. And that might be the kind. But of course, if you are not sure, please ask the patient to come back and see it in your own
Yes.
eyes. And
Yes.
if there is any questionable thing, I think higher lace is possible if you are using HA, right? Yeah.
True.
Um,
True.
More question about that is like, uh, how about if the patient don't feel like the result? Will you ask them to wait and how
Yeah.
long before you
Yeah.
higher
Yeah.
lace it? Because like,
Yeah.
I think for lips, most of the time, like we know that we inject this and then it swell a little bit further and that's
Hmm.
look not so good and the patient might get panic. So
Hmm.
is there any hand holding technique that you can ask the patient just to wait? Swelling will go down and you will get
Go
a perfect
down.
lips.
Yeah.
Yeah. Is,
Yeah.
is there any hand holding
So, yeah,
tricks?
yeah, yeah. So I've had once a product related issue. I don't want to name product, but you knew some of the new products which came into the market from a reputed company ended up giving these late allergic reactions or late reactions which just made the area swell after you injected. So I've had those where I really had to hand hold.
Mm-hmm.
Touch wood, most of the times people love what I do on their face. So I haven't had anyone coming and saying, I don't love what you've done. But I've had these incidences where it has been, oh my God. So there are two. One, if they say, oh my God, it's looking too much, I always tell them, hang on for 2 days because there is going to be swelling. We will end up waiting. I always ask them, is there still pain when you touch? If they say there's still pain, I always tell them, which means there is still fluid there. It is still healing. So it is still looking a little big. So you hang in till the pain fully goes from the lip, which takes a day or two for the pain fully to go. Then I say, now the fluid has completely gone from that place. This is what the lip will look like. They're mostly happy. Now, if they are not, like I said, product related things, then of course I handhold, you end up giving your antihistaminics, you end up giving your oral steroids, you wait and watch for again 2 days. 2 days is my sweet spot. After that, if I think, oh, I need to do something, I bring the patient in Then again, I touch and feel and see. Sometimes, even if you have done it very evenly, it ends up clumping a bit. Then you end up, kind of spreading it. It is spreadable even after 2 days. We know that. So we end up making it look a little more nicer and ask them to wait another day. If I think it is looking nice, but the patient is panicking. A lot of times, you've done a good job and
I
know that the
know.
patients will like it later. So you let them go. But sometimes if you think, yeah, maybe, I probably went wrong here. Let's look at the patient's judgment. Then 2 days later is when I might even think of dissolving. But so far, I haven't dissolved my own work in almost 18
Yeah.
years of practice. Yeah.
Yeah. So good technique. And one of the audience said, yeah, Sawadee Krap is like Thai word for hello. And yes, I'm from Thailand, proudly presented. Let's get to the question about the product, because you mentioned this before, like there is a different type of product that can be used for lip. Have you experienced using non-HA product on the lips?
We don't in India have non-HA products.
You don't have it? Same here.
No. Yeah. So
Yeah,
we don't have
I
the
think,
experience. I not on the lip, but we used to get radius in those days directly brought by some company. So I have used radius on the jawline. But no, non-HA product on the lip, I have no experience because we don't have it in India.
yeah, there is one question that they repeat asking about lip lift. Do you heard that kind of procedures like lip lifts? One of the audience asking.
Yeah. So what I'm thinking is, if you, for example, look at someone in the profile, you will look at the lip, and as they grow older, you will see this elongates and this folds in, right? So the lip is, that's what happens.
Yeah.
It starts
so
getting
it's
flatter,
go inward.
it falls down.
Yeah, so it's get inward.
Exactly. So to me, the only lip lift I do is when an old patient comes and I'm rejuvenating the whole face. And then if I see the lip elongate here, go down and fall flat, that's when I try and invert it. And that to me is giving the lip a structural lift. Because the dentition support is not as good as before. The lip muscles here have become more superficial. Subcutaneous fat is gone. The lip is lengthened because lip also thins down. So now what I do is I start working on the filtral column. I do the white roll. I also do work on the body of the lip to give them a nice volume and a lift. And then instead of this becoming like that, you're doing that. Yeah. So you're ending up making it more concave than convex. So that is the lip lift. And then on the sides, when the corners are drooping down as you grow older, you end up working from the jawline, pre-jowl area upwards. A blob there, a blob there, a blob there you could do. Or you can end up working here and then fan it all the way upwards. So then you're lifting the corner of the lip. So once you lift the corner of the lip and you invert and give a lip lift, so that becomes a beautiful upper lift. You also end up doing a little bit on the center of the lower lip to be able to support the upper lip. So that is the technique for a lip lift for me.
I know that we are always mainly focused on using filler for the lips. Do you have any experience using the combination with other treatment, and what will be your recommendation and in which condition?
So especially that we are talking about the lip lift now, as you grow older, there's a lot of smoker's line which starts to happen. Like I said, the muscle starts getting superficial because there is no fat now on the subcute tissue. So you will see more of those lines and the muscle action is much more visible. So I'd like to combine with the toxin there then. So we use a botulinum toxin, maybe just 1 unit and 1 unit, but you make sure you don't go too near to the filtral column and the apex of your cupid bow. You kind of go down and you just do 2 there because you don't want to flatten this area. You want to kind of ease this area. So you end up injecting there. So I combine it with Botox when I need it. And then I combine with Botox when there is a difficult lip. When I say difficult lip, there are a lot of people, when you look at them like this, lip is fine. When they smile, it completely disappears. It's gone. That lip, even if you end up sometimes ending up working on that lip and giving an enhancement, you will see it gets even heavier and rolls even further. So that gets tricky, and that's when I kind of ease the muscle action here with a little bit of a toxin. Then I work with energy-based devices. We usually use lasers. I use ultherapy. I use thermage. All of that to work around this to get the skin more nicer. The other thing that I do is an indirect approach where I start working with fillers from cheek. So there is already a support to the lip and the lift that happens. See me like this, to me like this. The lip is changing, right? Forget looking at my cheek and my nasolabials. Just keep looking at the lip and look at the lip. So that's why you start working temple downwards to work on the lip, and then last come to the lip when you're looking at an anti-aging. So that's my combinations.
Yeah. And when you do combination, like, if you want to combine with toxin, what will you do first? Toxin first or filler first? Or you can do it in one session?
One session. I usually do in one session, but I do the filler first because after the toxin, I don't want to be manipulating much. So I end up doing the filler, finish my manipulation or finish my massaging. Then I end up doing a little bit of toxin and they're out.
I see. How about energy-based device? Can we do it in the same session, or you need to set the interval of it?
Technically, I don't mind doing it in the same session, as in then I do the energy-based devices first. I do filler later, but with lips, if you do energy-based devices around the lip, what happens is there's a lot of heat of the tissue created, right? Then you end up injecting the lip, you may increase the chances of bruising.
I see. I know that we are talking about only like how to make natural, hot and spicy lips. But I think there is a question before at the beginning of the session about the pigmented lips.
Yes.
Do you treat that, and how will you recommend the patient to treat it?
So what we also do is, of course, start off with seeing that there are a lot of people I just see keep smacking their lip. Simply telling them stop licking your lip will reduce their pigmentation. And there's simply dryness of the lip which causes pigmentation. Dryness of the perioral region causes pigmentation. So I end up simply hydrating them. We could use hyaluronic acid injections to hydrate, or simply use a good home care cream to hydrate. Or sometimes I may even give them oral supplements to hydrate. Other than that, of course, we go through the nutritional and the hormonal issues. If there's thyroid, all of this you end up looking at. Then we can do some peels in the office. A Q-switched laser in the office is something that really helps the lip really, really well. And then simply doing a filler, when it expands the surface, the dark color becomes less dark, if you see. And then I give them home care creams like any of the skin lighteners, the kojic acids, the arbutane, the vitamin C's, whatever we give for the face. I tell them at night, just go ahead and apply it even on your lip. That works even that way. What's your trick for it, Rungsima?
So for me, if it's a real pigmentation, like, hydration will help. But of course, if the pigment is very dark, we can use Q-switch and the yak lasers, like, 532, and then we go over it. But of course, we have to tell the patient that they can swell because there is a downtime over so, but maybe 1 or 2 treatment will do fine. And they'll get a very good result in combination. So next question that I would like to move on is maintenance. So when you get them to the level that you said, oh, this is a perfect lips, how long it lasts, and how often do they need to come back and get lips done again?
Yeah, so I think the first time you do the lip, I have observed that it goes a little faster. I don't know, what's your observation? Do you also think that?
Yeah.
The very first time when you do the lip, it goes much more faster. Now, when I do the second time is when I see that it stays a little longer. The third time, it stays even better. So probably also there is material from the first, second, which is still remaining. So we're just adding to it for it to become better and better. Then it lasts a much longer time. There are times I keep telling my patients, please you don't need it. It has even lasted for a year. So yes, people love the lip and they forget how thin their original lip was. So they keep coming and saying, can I do more? Can I do more? I'm like, no, you know how your original lip was? This is already more. Calm down. But they won't listen. It's up to you and your rapport with the patient to tell them, let's go easy. You need to build it for the next whatever. If you're a 30-year-old, another 40 years, you want to do your lips. So let's go easy is what I keep telling them.
Yeah. So I think we already discussed about the people who scared of doing lips, and then you had the technique of convincing them. How about the people who already had a big lips, like, unnatural, and they still want more and more? How can you change their paradigm? What is your experience, and how you try to change their mind of not doing lips?
I show them the mirror. It takes some time. You sit and discuss with them and say, you don't need this. This is not going to look really nice. It's already overdone. And let me do something. Let's concentrate on these areas so the face fits to the lips now, not the lips fitting to the face. So you say, let's try and see how the face fits to the lips. And we'll try and do a little here and there. Then they look at it. They see it's natural. Then they say, see how natural you look now. So even the lips, I'm saying, let's go easy. Then they'll push you. Then what I do is I take a much thinner, just a hydrating HA, just a very little for them. So they're also satisfied that there's some tiny weeny done, but you're not adding a lot there. But there are some which come like completely bursting. I tell them absolutely no. Absolutely no.
I think lips is challenging. If you do too less or too much, it can be it won't look natural. Okay. Yeah. And then I'm asking you the limitation,
Sure.
What is the age range? What is the youngest age of the patient that you will touch lip? And is there any age limitation in terms of if the patient is 70 years old, you won't touch the lip? What is the maximum age? Minimum and maximum age of the patient?
In my practice, minimum is 20 or 21. I don't do before that because I always tell them, hang in, your face is still developing. Hang in, your rest of the face will kind of be different. So let's not do the lip. So I literally wait for them to have their 20th birthday or the 21st birthday, ask them to come with their parent and then do it. So younger age, I'm a little more stricter. Older, I have injected lips for 85-year-olds. So I'm fine with it because I really love doing the lips. I think that adds a lot of youthfulness to the face. So even if this very old patient, sometimes, there'll be very old patient where everything is coming down and they don't have a great budget. When they say, doc, but we can only do 2 syringes or we can only do 3 syringes. Then what I do is 1 full syringe I save for their lip. Because whatever little I end up doing elsewhere. Yeah, and that lip really looks good. And it makes them the change. It gives them the youthfulness. And all of us look at this much on the mirror, right?
Yeah. So, and what is the maximum CC? How far you go? How many CC, max for only lips only?
1.5.
No more than that, right?
No.
Mostly.
No. 1.5 also is it's not an everyday phenomenon, once in a while. 1 ml is something I'm happy to do. I have finished off lips and half ml also. So anywhere between half and 1.5 is rare. 1 is usually what I use. I think I have used 3 once, but that was not just for the lip. The lip and around the lip.
It's around.
Exactly.
Yeah, it could be. So, Rashmi, talking to you is really fun. Time flies. Now it's 40 minutes already.
Wow.
And I think there is a lot of question that asking about the technique, but however, Dr. Rashmi is elaborate her technique already at the beginning of the sessions. So we will post these as a story.
I can see a question here which says, is there fillers that you can do to widen your lips? Yes, why not? I usually love to make the lips smaller. I think that looks really cute. But if you want to widen your lip, like I was saying, as you grow older, this goes down. And then the lip starts to look so small. And a lot of patients tell me, doc, I used to have a nice wider lip and I don't like it now. Of course you can. In that case, you're working in the center, whatever you require. If you require volume, then you do it. Or if you don't require, then you don't do it. But on the side, you end up inserting your syringe from there. Go across to the upper border where the white roll, you've already built that. Then in the same thing as a fanning technique, you could go just underneath the white roll, the sub-vermilion, what we call, and then you end up doing a little more, which is just above the wet line. So I go 1, 2, and 3 fans. So that gives you volume to this area and also opens the lip up. And that makes your so-called small mouth a little wider mouth. So that definitely can be done.
I see. Do you have any final technique and tips before we end the sessions? Because there is a lot of people coming in. I just want to tell you that we will post the video after we finish, just in case if you missed the first part of the talk, which, like, you know, we had a very intense and informative discussion. So because of the limitation on the time, so is there any final tips and tricks or anything that you want to leave for your audience here?
So for a reason that it is Euromedicom and I'm chit-chatting with you, we've gone very highly technical. So, oh wow, the hearts at last. Please, come on, I need some hearts. Those are so
Yeah.
cute. Yeah. So I've been very technical. So the ones who have logged in who are not doctors, I'm sorry we've made it very technical, but you could always go to one of our social media handles. I'm sure there'll be a lot of more easy things that we talk about the lip and what you really want to know. But for my doctor friends, what's the last final tip is don't get scared to do the lip. And lip adds so much. A lot of times I get asked, doc, people are on a budget, they just have one syringe. What do I do? What do I do? So when you have that one syringe, if you even use half a syringe under the eye and half a syringe on the lip, the patient is going to be thrilled. And if you have two
I
syringes, one
know.
around the under eye area and one on the lip and around the lip, would really be nice. And it gives them that wow instantly. Then you can end up saying, oh, actually, I don't want to put it here. I actually have to rightly build it from here. You can do that. You can get there. But giving that initial wow, please do the lip. Don't get scared. It's not that scary. If you stay in the right plane and if you stay on the dry area, as I said.
And you know, actually, if you are a fellow doctors listening to us now and want to learn more about tips and tricks like this, we will have another session in webinar coming very soon, hosted by Euromedicom. Like you will see Dr. Rashmi and me again with other fellow Asian colleagues. And then we will
Yes.
have like a series of technique, like, you know, we will have more intense discussion and, you know, go on all the techniques and how to inject it effective and very safe. All right, for tonight, I would like to thank you, my dear. I'm so happy to hear that you get back to your practice. I hopefully want to get back to my practice very, very soon. And again,
Yes.
thank you, Euromedicom, for hosting us. Like, you know, we'll see
Thank
you
you,
again.
Euromedicom.
All
Thank you,
right, all right.
Euromedicom. Thank you, Rungsima. That was really lovely chatting with you. And also for those who want to read a little more, I have written a chapter on the lip enhancement in our official IADVL handbook, which will be released soon. That should help. See you soon. Thank you, Euromedicom, and thank you, Rungsima.
Bye. Thank you.